WAJR and the AJR News Network welcome you to Wellness Wednesday, North Central West Virginia's premier medical talk show, presented by Fairmont Regional Medical Center, the only hospital in West Virginia to be recognized 4 years in a row as a top performer by the Joint Commission. Now, here's your host for Wellness Wednesday, Kyle Wiggs.
And good Wednesday morning. It is a Wellness Wednesday on WAJR and the AJR News Network. And Dr. Luke Davis is with us. And you're an old pro at this. You've been in here before. That's good. It's good to hear from you. And you've got a guest with you this morning.
I do. This is Brittany Rubenstein. She's our newest hire at Fairmont Rehabilitation Center. Right now, we're really starting out in a venture to kind of get pediatric patients serviced in an area where we've really been underserved for years. There's just not a lot of clinics around. Fairmont residents are taking their children to Morgantown and to Clarksburg for appointments and therapy, and they're just, because there's just really nothing here to offer them. So we've brought Brittany in, and we're really excited to kind of get this started. We've got room and space all worked out, and we've got some swings and tunnels and all sorts of things that are on order, and they're ready in the clinic. So we're pretty excited right now.
Well, Brittany, good morning. Welcome to Wellness Wednesday.
Thank you.
Talk about your background a little bit.
Sure. So I graduated from WVU in 2013 with my master's in occupational therapy. Since then, I've been working in pediatric occupational therapy for about 2 years, and just started at the Fairmont Rehabilitation Center in July, and I'm really excited to be here. All
right. And the types of services that you offer, as you mentioned, Luke, people from Marion County, perhaps Harrison County, have had to travel to Morgantown, but you're going to open up some new doors and some new avenues for folks to be able to get the care they need for their children right there in Fairmont.
Yeah, absolutely. And we already service a lot of Marion County for our other physical therapy. We have occupational therapy and speech therapy. This is just our newest focus. Now, we've always seen pediatric patients. This is an expansion, because we're outgrowing our clinic. We're a busy place, so we actually had to add another room and office and desks and those sort of things to accommodate this, because you can't just say you're going to do it and not have the space to do it. So we're finally able to be able to offer this service.
And Brittany, you just start by talking about how fulfilling it is to work with the youngsters, with the kids, and to help them advance.
Sure, I absolutely love it. It's really why I went into occupational therapy and why I love pediatrics. I love partnering with the child and their family and forming those lasting relationships. Seeing the child grow and develop and going through those milestones with the family and with the child is really rewarding.
Mm-hmm. And what are the types of things that you do?
Sure. So in pediatric occupational therapy, we look at the child's main occupation, which for children, that's simply play, because through play is how they learn, how they develop, how they grow. So if there's something hindering their ability to participate and play appropriately, then we need to look at that. We need to look at the skills that go behind those play activities and help them function better in their daily lives.
Yeah, the daily activities, so those are important. I mean, it's always fun to play, but in terms of combing their hair and putting their hair into a ponytail, or brushing their teeth, or just basic hygiene, that's important too.
Of course. So, we said their main occupation is play, but the other occupations that children participate in are being a student, going to school, doing those daily self-care, hygiene types of things that they need to be able to do to get themselves ready for school. All of those things go into what we do for kids in occupational therapy.
What are some of the techniques that you use? How can you better, I know every child's different and every case is different, but being able to use their hands and being able to do things for themselves.
Sure. So we look at, what's hindering them from being able to complete these tasks. So is it a strength concern? Is it a coordination concern? Is it, memory, going through the steps of the processes of doing these things? So we really, in the evaluation, look at each of those things and determine what needs to be improved in order for those activities to come along for the child.
Mm-hmm. Talk a little bit, and both of you can jump in here, but when when a child is developing very young, learning to walk and learning those motor skills, when should a parent be concerned, or what are some signs that would be there if perhaps there is an issue with autism?
Sure. So, autism is on everyone's radar right now because unfortunately it is becoming more common in our society. So the main red flags that we look at and that we educate parents about would be things like consistently not meeting those milestones, the gross motor milestones, the speech milestones, the fine motor coordination milestones. And then also some more specific red flags would be like the child not making eye contact, speech delays, wanting an adherence to a very strict schedule, and having meltdowns when those things don't go their way.
Yeah, autistic kids they seem to be very routine oriented, and when you get out of that, that's when they seem to have issues. So when should you call a doctor? When should you seek a second or a third opinion on whether your child has issues like this?
Sure. So I would say, if a parent has any concern at all, don't hesitate to reach out to your pediatrician. If you're seeing any of these delays, anything that's not age appropriate, even if you're not sure, reach out to your pediatrician. You can contact a therapist. We can talk to you and kind of observe your child and see what's going on, and if there are any founded concerns that we can help your child with.
Mm-hmm. And other special needs children, I know you kind of specialize in that in terms of Down syndrome or cerebral palsy. There's some other categories in there as well.
Sure. So, and if a child has a diagnosis like that, most likely their pediatrician will have already recommended related therapies such as OT, PT, or speech. But of course, if not, please reach out. There are things that we can do to help.
Mm-hmm. We are with Brittany Rubenstein, as Dr. Luke pointed out, the newest employee, right? The Fairmont Regional
She is our
Medical
newest,
Center.
freshest, brilliant employee that we have right now. Yes.
In terms of how many patients you see, or you have Brittany, I would imagine that there's other people that do the type of work she does as well.
Yeah, we actually have 3 occupational therapists, including myself. I'm an occupational therapist. We have 3 of us, and then we have 2 speech therapists, and we have, I'm going to say 9 or 10 physical therapy and physical therapy assistants mixed in there in that office too. So it's a booming little clinic.
Any thoughts? As you said, one of the key things earlier, Brittany did, that autism seems to be more prevalent. I mean, I know there's probably a million theories as to why. Do you guys have any theories as to why more and more children seem to fall on this spectrum in some way?
I mean, I think like you said, there's thousands of theories. You talk to different professionals and they all have a different opinion. I think it's a combination of things. I think for one thing, there's more education about autism out there, and so it's being diagnosed more frequently. I think that, our environment plays a large role. You look at, the way that we eat, the things that we eat, the things we come into contact with. And then too, unfortunately, as technology has advanced, I think it's also hindered children in their development. They're not getting out and playing and doing the things that they need to do, like we did 20, 30, 40 years ago. So I think it's a combination of things, really.
And on the positive side of that, they're getting more and more help. I mean, there's
Sure.
more awareness. There's more things that have developed in terms of helping children with these issues. They are getting more help.
Yeah, definitely.
Mm-hmm. How has that changed since how long have you been at this?
12 years now, I think.
And you've seen this evolution right before your eyes in
Yeah.
terms of more kids.
And it's been in the past, 10 years?
Yeah.
Where it's come to the forefront with celebrities chiming in, and it's definitely, it's here.
How have you seen the treatment change?
Well, some of the strategies, and even Brittany can attest to this, because as a student, when we first started treating patients, and pediatrics especially, you kind of have archaic ideas of what helps and what doesn't help, and to gear it this way. But even in the last several weeks, watching Brittany work, I wasn't doing it right, and I could tell that now. And things have changed in his school. The schools have become better. So when the students are coming out, they're far better prepared than what I was when I came out of school. It's an amazing difference, actually.
Mm-hmm. And Brittany, you've been at this a few years. Just kind of talk about that. How how these treatments and how these things have developed just recently. There's been some breakthroughs, right?
Sure. I mean, the things that we know now are awesome. You know, and I think to kind of go along with what Luke said, you know, each child is so different. You know, they call it the autism spectrum because each child's autism diagnosis is so very different. So there's not, you know, a necessary set of guidelines of treatment for a child with autism. It's all about getting to know the child, getting to know the family, and learning what works best for them through therapy.
You've got a free screening day coming up, right?
We do. This is something we've actually just kind of, it's coming together right now. We're going to start to do a little advertising on it. But we're going to have a screening day at the outpatient clinic. We're located in the Healthplex off of the South Fairmont exit 132. We're on the first floor there. It's going to be on August the 12th from 1 to 6 o'clock, and it's going to have to be by appointment only because we're still going to have patients in and out. I'm just going to have additional staff there to do screening, and Brittany will be there. Of course, she'll be our main one that'll do the screenings. So we're excited about it. We haven't had a screening day in quite some time, and with our new service, I think it's a necessary thing to bring in and make sure that people are aware of like some of the things that Brittany's talked about this morning.
All right, free screening day, August the 12th from 1 until 6 by appointment only. Call 304-363-3167. And at that point, you only have a short period of time with each patient. What do you look for there?
Sure. So what we'll do is we'll spend probably 15, 20 minutes just talking with the family, talking with the parents, and really hearing them voice their concerns about their child's development. Maybe they had trouble last school year and they're wanting to get on top of things before the new school year starts. And then we'll spend a few minutes just observing the child in a play activity and looking for any red flags.
Mm-hmm. Talk about some of the other things. You talk about red flags, and I know some other things you're well versed in. Sensory disorder. Define that, and how does that come to the forefront?
Sure. So sensory disorder, sensory disintegration is something very new as well. It goes pretty much hand in hand with children that have autism or developmental delay. And basically what that is a child has difficulty taking in input from their environment, whether it's visual input, auditory, hearing input, taste, smells, things like that interfere with their behavior, their ability to learn and function in their daily lives.
Mm-hmm. How do you determine that?
Usually through a lot of observation, a lot of parent interview, a lot of surveys. Typically after spending a couple hours with a child, we pick up on those things, and then we're able to implement strategies for home, for school, so that they're better able to function.
Mm-hmm. CVAs?
Mm-hmm.
What are we talking about there?
So basically stroke. So infants that have had a stroke in utero or very early in life, we do see, unfortunately, it's not very common, but we do have some. And, you know, with those, you're looking at strength issues, coordination issues, sometimes cognitive issues because of the stroke that they've had.
Mm-hmm. All right, very interesting. All of the things that you can get help with, no question. Fairmont Regional Medical Center. Dr. Luke Davis with us, also Brittany Rubenstein, one of the newest employees there, and working with the children in rehabilitation service. 296-0041, that's the number to call if you have a question or an issue. Again, that free screening day at Fairmont Regional Medical Center, August 12th, 1 until 6 o'clock. Call 304-363-3167 for an appointment, and you said that's located...
Yeah, right off of exit 132 in South Fairmont. It's in the big $1 million.
Can't miss it.
Can't miss it.
Can't miss it. All right, 296-0041. That's the number to call if you have a question. Stay with us. Wellness Wednesday will continue.
Now back to Wellness Wednesday, presented by Fairmont Regional Medical Center on WAJR and the AJR News Network.
Wellness Wednesday for this 22nd of July. We are with Luke Davis, Director of Rehabilitation and Program Director for Kindred Hospital's Rehabilitation Service. And Brittany Rubenstein is with us as well. And Brittany, there's some exciting things. Luke was talking about how great of an addition you've been to the facility there, but it's only going to get better. Talk about the service dog you're working with.
Yeah, so we're really excited. As one of the things that we're adding to the pediatric program is a therapy dog. So my husband and I are in the process of adopting a 3-year-old golden retriever. Her name is Ava, and right now she's in a service dog program, and when she comes out, she will have the title of Rehabilitative Facility Therapy Dog. So she will actually be coming to work with me, and so we're excited. She's going to add just a whole new plethora of interesting things to the clinic. But so basically, she'll serve as a motivational tool for our clients, especially for the children. She'll actually be involved in treatment activities, and too, just the emotional benefit that I think our kids will get from being around her.
And just that's incredible. I mean, is that something that's kind of new to the profession, or is it something people have been utilizing?
It is. So, it's basically in the realm of animal-assisted therapy. So using any animal as a treatment tool in therapy, whether it be OT, PT, or speech. And there is, more and more research coming out about it with just great results with patients doing better in therapy because of it.
Do you have a big enough car going back and forth with the dog to work every day?
I do, yeah. She'll be fine.
Dog will take over the car,
yeah.
Take over the business. Everybody will love the dog. All right, define hippotherapy.
Sure. So another thing that we're looking into is offering hippotherapy for our clients. So hippotherapy is the use of a horse in therapy, whether it be OT, PT, or even sometimes speech. So the child will actually be on the back of the horse, performing therapy activities from the back of the horse, riding the horse. So again, kind of like the dog, it's considered an animal-assisted therapy, and it's just going to add a whole new motivational factor for the child. It'll be, a treatment tool, motivational factor, and again, the emotional benefit of interacting with animals.
How exactly will that work? I mean, you're not going to have a horse that you're bringing to work every day.
No, that would be silly. We're actually partnering with a couple facilities in the area that already do therapeutic riding with just a certified therapeutic instructor. So we're going to partner with those facilities, and our patients will meet us there. So
very interesting.
Yeah.
So bringing the added aspect of animals into treatment and into therapy. I think that's fascinating. Kind of taking the next step. All right, how do people get a hold of you?
Yeah, anytime that there's questions, we're always more than ready to answer, and so we're always available by phone at the clinic. Our number is 304-363-3167. And then the website for the hospital is frmcwv.com.
Fairmont Regional Medical Center. So give them a call. And again, that free screening day, August the 12th from 1 until 6. You need an appointment. Please give them a call, 363-3167. You have the basketball team together?
Not yet. I got to find out who my players are this year. Can't wait.
So no summer tournaments?
No summer.
No, just get them going in the fall and in the winter.
Every time I see them around Walmart or wherever they're hanging out, I say, keep running, stay in shape.
How many listen? Hard to tell, huh?
No, not all.
Well, just spend a minute. We got a minute left in the program,
Sure.
And just kind of talk about that and where you compete and what you do with the basketball team there.
Yeah, the Marion County Special Olympics is a program that's been going for a long time. I've been coaching the basketball team for it must be 8 or 9 years now. This past year, we won the gold medal for the first division, which is the highest division you can play in basketball. And what a great squad! But we actually have Fairmont Seniors Gym. They donate that gym to us so that we don't have to pay rent, because gyms can be pretty expensive to rent. So that's always been a great thing. We get to practice and we play our games at state tournaments at the rec center in Morgantown.
Oh, very good. And you won it all this year.
We've won it all.
A lot of pressure.
It was pressure.
Is that the first state championship?
That was the second. I won one maybe 3 or 4 years ago as well.
All right. What'd you do to celebrate?
Nothing. We just a bunch of high fives and pats on the back.
No
we got
ice
a big
cream,
gold medal.
No cake.
No ice cream or
no
cake.
No T-shirts. Nothing.
Good pats on the back.
Did you get to cut the nets down?
We didn't even get to cut the nets down because they push on to the next game already.
I see.
So.
All right. Well, have fun with that, and I'm sure you'll keep us updated as to how that goes along. All right, Luke Davis, the Fairmont Regional Medical Center Director of Rehabilitation and Program Director for Kindred Hospital's Rehabilitation Service, and Brittany Rubenstein, your debut. Great job. Come back, please.
Thank you. I appreciate it.
That'll do it for Wellness Wednesday for this Wednesday morning on WAJR, the AJR News Network.